Good evening, everybody, and welcome to MHPN's webinar tonight. We are fortunate in having 1,895 participants who have registered tonight, and I see that many of you are on already and sharing stories and locations. Just looking at the general chat, we seem to have all states and territories represented, so that's great. Tonight's webinar is working together to manage substance use and mental health issues. Do feel free to say hello to each other and do feel free to ask questions as we go through the webinar. Tonight's panel is very talented. We have Adrian Dunlop, who's an addiction medicine specialist from New South Wales. Adrian, it's great to have you here with us tonight.
Thanks so much, Michael. Pleased to be here.
That's great. You've been instrumental in Australian drug policy for over 2 decades. Have you seen much change over those decades in drug policy?
Our policy hasn't changed. I think what has changed is the level of awareness in the community of problems from alcohol, tobacco and other drugs has increased, and I think we're having a more mature conversation than we were some time ago.
Great. Thank you very much, and we so look forward to your presentation and talk tonight. Now, I'd like to welcome Richard Clancy. Richard is a nurse and academic. Richard, you've been working on a project monitoring self-reported use of new and emerging psychoactive substances. What are some of the main findings from this research?
Well, this particular study took place in an acute inpatient mental health unit that works with people who have serious mental illness as well as a substance use issue. And we found that over 50% of those people admitted to the unit had used some form of novel psychoactive substance at some point in the past. And we've been following that population through for a period of time, and we're certainly finding that the more recent use of synthetic substances, including synthetic cannabis, is reducing amongst this seriously mentally ill population.
And that would have influence future treatment and strategies?
I think so. I think it's an important change. There was, we think that perhaps the reason that people with mental illness were using these substances to such a high degree was that they believed that they were safe, they were freely available prior to the legislation changes. Now with the legislation changes, accessibility